people notice changes in their thinking or memory when being treated for cancer, like taking longer to figure out solutions to problems, forgetfulness, or not understanding things as quickly as you used to. These changes could be due to cancer or the side effects of cancer treatment. You may hear other people with cancer say, "I have chemo brain," or brain fog, to describe some of these changes. I like saying brain fog because these changes in thinking do not only happen because of chemotherapy. The presence of pain, emotional distress, and lack of sleep, all common things people deal with during cancer, can contribute to these thinking changes. Brain fog can be distressing and disruptive in life. It is totally normal to be upset, annoyed, worried, or angry about it. One quick note, if you or a loved one has cancer that is in the brain, then thinking problems may be more severe. That is a whole other topic to deal with that is a bit more involved. If that describes your cancer, some of this advice may make sense for you. Some of it may not. Make sure to talk with your doctor about any questions that you have. First step, talk to your medical provider about this. Some medications may be helpful for these symptoms. The place to start is by telling your medical provider about the brain fog symptoms you've noticed and asking them about resources and options for dealing with them. Often brain fog cannot be avoided, so the job is to accommodate and adapt and change one's life with these symptoms in mind. When we're dealing with brain fog, it can be tough to do things that used to be easy. This is frustrating and can feel really scary. Before these symptoms, you may have relied on being able to hold 3 things in your mind at once, multitasking throughout the day. During cancer treatment, you may find that multitasking is not your friend. If that is the case, you probably need to adapt by changing the way that you do things. Instead of multitasking, it can help to focus on one thing at a time. Just slowing down might help as well. Reminder systems like phone apps, journals, or lists can hold your memories instead of relying on your overburdened mind. Outsource some of that thinking energy to these things. The name of the game is adapt. That may mean planning the things that require the most thinking energy for the beginning of the day, before you get tired. If you have a person who can help you plan, organize, or remind you about things, ask them for help. You can also try getting involved with a support group. Ask your medical providers about support groups in your area. Talking to others going through the same thing can be really, really helpful. General things that help everybody with brain health are focusing on getting better sleep. Check out that sleep video in our series. Getting good nutrition, exercising as you are able, and trying to stay mentally active by connecting with friends and learning something new. Give one a try. Sometimes your doctor may refer you to neuropsychological testing to better understand what is going on in your brain. Therapists with specialty training can also help with managing brain fog. Ask your provider about getting connected with a therapist. Most people report that the symptoms of brain fog get better when treatment ends. When you're feeling better emotionally and physically, your ability to think and remember will likely get better. For example, if a lack of sleep is causing these problems, then when the sleep gets better, the symptoms get better. In some cases, these cognitive symptoms do not go completely away. The overall picture is that there are things you can do. Review the options in this video to get started, or bring them up next time you talk to somebody at Tennessee Oncology.